During a long drive home, Rachel Harper felt that the unusual cramp in her leg was nothing to worry about.
I just thought that, I was driving, my mom wasn't driving, it must have been just from using that over and over and over again, and I wasn't comfortable and whatever else, because we're putting in 10-hour days. And as the trip progressed, we got to Maine to visit one of my best friends, and I could barely walk. And so I jokingly said to my mom, haha, I probably have a pulmonary embolism.
That comment hit home for her family after Rachel's father had previously suffered through the condition. But Rachel thought nothing of it until symptoms worsened.
I coughed and I brought my fingers to my mouth, and whenever I pulled them away, they were like covered in blood. And it was like thin, not like mucousy blood. And so I was like, and Matt instantly was like, we're going to the hospital, that's not normal, we're not going to risk this.
A pulmonary embolism is caused when a blood clot travels to block the main artery of the lung. After her husband persuaded her to go to the QEH, the staff there realized her condition was serious.
You're going in right away, your priority, and I think we sat in the waiting room chairs for maybe 30 seconds just so that they could prepare a bed and everything, and then rushed me through.
Rachel's mother, Heather Cutcliffe, was terrified at her daughter's prognosis, but due to her years of experience working at the QEH, she was confident that Rachel would get the right care.
Hardly any of us slept that weekend. We were all really concerned about, what was going on. We were delighted that she was able to be managed from home, that she didn't have to be in the hospital, that she was able to come back and forth and be seen by the physicians and the staff in emergency as well as in the same-day treatment unit. Yes, I work here. Yes, I'm biased, but I've worked within this hospital since it opened, and I don't have anything negative to say about it, about the staff, and about the care that we provide.
Although she always needs to be aware of further complications, Rachel is grateful for the effective and compassionate care she received at the QEH.
I could have died. I was really lucky. I'm very fortunate that I am where I am. I had this hospital setting right in our backyard, that my husband made me go, that I had Dr. Bergen and Dr. McGinn, who was so diligent in finding out what was wrong with me, that I have Dr. Castle to rely on, and that I had the nursing staff at Same Day who were above and beyond what I could ask. So there really is no words for how amazing they were. Honestly, it makes me emotional just thinking of all of the people who, and I guess I know it's their job. I know that the doctors are supposed to make sure that you're healthy, the nurses are supposed to do what they do, but there's something special about the way that they do it. In the entire time we were there, I was there for almost a year, and there wasn't a scowling face. There wasn't a person who was too good to answer questions or take care of you. There's no words for how strongly I feel about the staff at that hospital and the hospital as a whole.